Ladies and gentlemen, we live in historic moments. Still can't believe it. Today is Monday, June 7th, 2021. It is about 7:45 or something in the morning, and it is overcast. You can see it's pretty overcast. It's a nice morning, but it's a little bit humid and overcast. It's fine. I am here walking Doki. Well, actually, I am walking. Doki is in his little carriage, el cochecito. Da Doki. I already gave him two laps of actual walking, and then I got the carriage and I put him in the carriage. So now he's just chilling and enjoying the view. He loves it. He's getting better from his eye condition. He's doing a lot better. I just wanted to make this video just to let you guys know that I am having surgery. I'm getting surgery this Friday, June 11, 2021. I'm getting surgery. What am I getting surgery for? Well, I have bilateral direct inguinal hernias on both my right and my left side. You know, that's what bilateral means. So that's two hernias, and I have a third hernia in my belly button, my umbilical cord. So no wonder I was in so much pain. I've been in pain for a while. I don't know how long. It's been, I don't know, a couple of years, maybe more. It's a slow process. The hernias, they happen gradually with time, but it got to the point where it started to bulge out. I thought it was just one. Well, initially I just thought it was a cyst in my groin area. The thing started to bulge out, and I said, "What?" So I went to the doctor, and she checked, and she sent me out for a CT scan and ultrasound, and yes, finally got a diagnosis: bilateral direct inguinal hernias and an umbilical hernia. All right, so 3 hernias in one. I already went for the surgery consult. I met my surgeon. I talked about the surgery a little bit. I have my pre-op consultation this Wednesday, the 9th. So he's going to talk to me about exactly what's going to happen and what I need to do to help myself with the recovery. I will be operated on by a robot. It's robotic surgery. So basically the surgeon is obviously controlling the robot, but the robot will be actually cutting and stitching or whatever. So it's gonna be very interesting. It's I've never had surgery before of any type. The doctors are very excited about my surgery because I'm a rare case, because I have 3 hernias. People usually just get one at a time. So they're gonna take care of all 3 with the robot. He says that it's the best, it's the most precise, the less invasive. So the incisions are smaller, and the recovery time is less. The difference is not, like 50% less, or no, it's like it is less, but he said that it's still gonna hurt. They're gonna put a couple of meshes in inside me to cover up the tears, you know, the hernias. I don't know if you guys know what the hernia is. It's basically a tear in the inner abdominal wall, through which the intestines pop out. And so I can actually feel that. It bothers the heck out of me. And yeah. So if I don't take care of it, it can become a serious problem, because the hernia, or the intestines that are peeping out or peeking out, can get strangulated, which means that the blood flow to the intestine part can stop. And if it stops, that part of the intestine can die, can become necrotic, which means that I will die of septic shock if I don't take care of this. Right now, it's not serious because it's a pretty routine surgery, but it can become serious if I don't do anything about it. So yes, I am having it taken care of, and it's an outpatient procedure. I don't have to stay in the hospital. The surgery, I believe it's about 4 hours, and then I go home. Of course, I have to be driven home, and then for the first 3 days, I was told that I'll be in bed, or but then gradually I'll be able to move, and then the more I move, the faster I'll get better. So anyway, that's an update. I'll see if I can record something. Probably not. When I get to the hospital and stuff, because I did want to do a vlog about it. I'm going to ask the surgeon on Wednesday if I could get a copy of the video of this robot with 4 arms. I think it has 4 or 6 arms or something. It looks like a spider. I've seen YouTube videos on it. And see if I can get a copy of a video, because I signed a waiver or whatever, permission. I gave him permission to be observed. They said that I am the perfect candidate because I am of the perfect age. I don't have any medical conditions, and I have 3 hernias. So they are very excited. They looked at me like, like I was some sort of like a kid in the candy shop. There's, oh yeah, is it okay for us to operate on you? The doctors were younger than me. So I said yes. I mean, I guess some people may not want to be operated by a robot, but they're very excited about it because they'll be using the robot. The surgeon that's going to do the operation, Dr. Gielow, he is the surgeon that teaches other surgeons how to use the robot in this area, or in Orlando, or in Florida, or something. He's like the main surgeon that teaches other surgeons how to use the robot. So I'm excited about that, because I know that I can trust him, and he's been doing it for years. So anyway, that's an update on my health. Doki is still very happy and relaxed, and I'll keep you informed. We will keep you informed.